a patient, there are many things you can do to help ensure a successful surgical outcome. This includes reducing bacteria on your skin that can cause a surgical site infection. One way you can take action is to prepare or prep your skin at home before you go to the hospital for surgery. This is called early prepping, and it is recommended in medical journals and professional guidelines for the prevention of surgical site infection. This video shows this contemporary approach to early prepping with 2% CHG prep cloths on the night or nights before surgery, as used by one hospital and as highlighted in published studies. Always follow your healthcare provider's instructions for early prepping. If you have questions, please contact your provider. Before using the 2% CHG prep cloths for early prepping, here's some important information you need to know. Do not use 2% CHG cloths on your face or near your eyes, ears, or mouth. Also, do not use them on broken skin or open wounds. If you shower or bathe before early prepping, wait until your skin returns to normal temperature before using the 2% CHG prep cloths. Apply them to cool, dry skin. Use one prep cloth for each area of the body. Apply to each area thoroughly for coverage. The 2% CHG solution in the prep cloths stays on the skin and should not be rinsed off. You may want to ask a loved one or caregiver for assistance. To get started, remove the Prep Check sticker and affix it to the prepping instructions given to you by your healthcare provider. Be sure to bring this with you to the hospital for documentation purposes. Open the outer package. Inside, you'll see 3 packages. Each contains 2 prep cloths. To open them, tear at the notch on the back of the package. Begin the early prepping process from chin to toe. Always follow your healthcare provider's instructions for early prepping. Dispose of the 2% CHG prep cloths in the garbage. Never flush them down the toilet. Allow the area to air dry for 1 minute. Do not rinse or towel dry. It's normal to feel a slight tacky feel to your skin after applying CHG, and it will go away quickly. Stop use and ask a doctor if irritation, sensitization, or allergic reaction occurs. These may be signs of a serious condition. Do not apply lotion, moisturizers, or makeup after prepping your skin. And do not shower or wash after prepping your skin. Be sure to wear clean pajamas to bed and sleep on clean sheets. On the morning of surgery, do not shower or bathe. Wear clean clothes to the hospital. When you arrive for surgery, give your nurse the prepping instructions with the Prep Check label attached for documentation purposes. You have taken an active role in your care by prepping your skin early, at home, before surgery. Your efforts will help reduce bacteria on your skin, a primary risk factor for surgical site infection. It's one important and recommended way you can help ensure a successful surgery. For additional information about early prepping before surgery, please contact your healthcare provider.